You're still watching Good Morning Nigeria on the network service of the NTA. And to begin our conversation on bridging gaps in nutrition, here's a background report put together by our correspondent Abdusalam Jibril.
According to the famous Greek physician Hippocrates, let food be your medicine and medicine be your food. Some nutritionists maintain that the physician was simply emphasizing the importance of nutrition rather than the mere consumption of food. They insist that nutrition is a critical part of health and development, and better nutrition is related to improved infant, child, and maternal health, as well as stronger immune systems, safer pregnancies and childbirth, and lower risks of non-communicable diseases. In Nigeria, available data from UNICEF reveals that an estimated 2 million children also suffer from severe acute malnutrition, but only 2 out of every 10 children affected is currently reached with treatment. The country also has the second highest burden of stunted children in the world, with a national prevalence rate of 32% of children under 5. The data also reveals 7% of women of childbearing age also suffer from acute malnutrition. The World Health Organization (WHO) says the nutritional challenges in Nigeria include poor dietary quality, high prevalence of malnutrition in all its forms, limited data to assess the nutrition situation, and inadequate progress in meeting the 2030 nutrition targets. Towards addressing these challenges, Vice President Kashim Shettima will on Tuesday, April 23rd, declare open a summit of faith leaders on nutrition in Nigeria. The one-day summit, in collaboration with the National Council on Nutrition and the Accelerating Nutrition Results in Nigeria project, aims to define sustainable pathways for improving maternal, infant, and young child nutrition practices in Nigeria. Despite concerted efforts and policy frameworks over the years, malnutrition remains a pervasive issue in Nigeria, notably among children. How does the summit aim to turn this around? Is the country on course to meet the global nutrition target by 2030? These will form the crux of discussions as guests speak to bridging gaps in nutrition in Nigeria shortly.
All right, thank you very much, Abdusalam Jibril, for that background report. And joining us here in the studio to discuss this topic this morning is Dr. Zainab Kwaru Muhammad Idris, Project Coordinator, ANRIN, project in Kaduna State. Welcome to Good Morning Nigeria.
Thank you.
Would you mind?
And we also have seated here in the studio Dr. Ojualape Olutosin Solanke. She's the National Project Manager, ANRIN Project. Good morning.
Good morning.
Got your
Good
name
morning,
right.
Nigerians.
Yes. But we also have seated here in the studio Stalin Kocha, Senior Special Assistant to the President on Media and Communications Office of the Vice President.
Thank you so much.
Good morning, Nigeria.
Thank you.
It's a
Pleasure to be here.
To have you.
Same.
Victor?
Okay. Dr. Solanke, since you're National Project Manager, talk us through, why nutrition has become so important for a nation, our nation, to worry about. What is ANRIN, by the way?
ANRIN is the Accelerating Nutrition Results in Nigeria, and it's abbreviated as ANRIN. Okay. So, as a project, we have the objective of increasing the utilization of quality, cost-effective nutrition services among pregnant women, lactating women, and children under 5 of age. So why is nutrition important in Nigeria? As we can see, and scientifically proven, nutrition has direct relationship with growth and development of any child. And for chronic malnutrition, which is the aim of what we're trying to prevent, ANRIN project is mainly a preventive measure by the government of Nigeria to address the issue of malnutrition in Nigeria. And so if you have a child, we normally say the first 1,000 days of that child is very critical. If you miss that opportunity, for that child to be well nourished, the child is unlikely to grow effectively. He will succumb to diseases easily. Is unlikely to achieve his potentials in life, because a malnourished child will not do well in school, would be grappling with diseases, and eventually it cannot be productive as an adult. So it is directly related to economic prosperity as well, and human capital development. So it is very important for a nation who wants to grow economically to pay attention to the issue of nutrition.
Okay, well, where are we as a nation? Are we at that stage where it has become important to do something, or we are just taking steps to prevent?
So with the statistics that we have at the current time, at the moment, we have about 37% of every child, of children that you see in Nigeria, they are malnourished. So it is a very grave situation that we have to step in and address immediately. And I'm not surprised while the current administration of His Excellency President Bola Ahmed Tinubu is paying huge attention to this through various avenues and platforms that we have. His Excellency, the Vice President, is the chair of the National Council on Nutrition in Nigeria. So, and is passionate about the issue of nutrition because we can link it to economic growth of any nation.
Yes, the Vice President is interested because I remember in Maiduguri during the Boko Haram crisis, there was a program like that through the Ministry of Health. Now, with a population of almost 200 million and most of them younger children, I'm coming to Dr. Zainab now. What are the most significant nutritional challenges facing Nigeria, and what are the measures to address it?
Yes, I think the National Project Manager has highlighted the importance of nutrition and why we are implementing the ANRIM project, which is a World Bank supported both financially and technically. For us, the most challenging that we have currently has to do with the issue of information. How is information getting across to people for them to know the right kind of practices to imbibe? And that's why we're interested in ensuring that maternal, infant, and young child nutrition counseling is very key as part of the intervention that is being provided through the ANRIM project. It's targeting our target beneficiaries, who comprise of the pregnant women, lactating mothers, adolescent girls, and caregivers of children less than 5 years of age across our project states. In addition, we are also doing what we call the social and behavioral change communication, which is an innovative approach, which also involves, use of mass media campaign, where information around key messaging is being provided across our different media outlets. We also have the innovative interpersonal communication counseling that is done through our faith leaders and faith actors. We know that they are very important, especially in terms of them serving as a conduit and a bridge between the people and the services that they need to provide. The correct information that they provide through their messaging helps to also communicate those practices that will really help address those key challenges. So coming back to those challenges, apart from the information, we have, people have to have access to information. A lot of the times you don't get to see that. In addition, we also have financial challenges, that is getting enough funds for these services to be provided in the first place. And then we also have the issue of household food security, where we expect people to have the right food items available to them, for them to also know the kind of combination that they need to do, especially for those vulnerable population groups. If you're looking at like the first 1,000 days of a woman's life, of a child's life that was mentioned, it's from the conception, from the time of conception of that child to when the child clocks 2 years of age. So that period is very critical. If you don't have enough nutrients for that child, it's likely that it will affect their cognitive function. It's also likely that it will not enable them to have the desired educational outcomes. And of course, along the life cycle, they tend to also have low productivity when they become adults. And as a result, it impinges on the GDP. For instance, it has been shown, or it has been mentioned, that 11% of our GDP is lost as a result of chronic malnutrition. So these are very serious challenges that we have. And then, of course, access issues, how are people able to access the services, and then people that are very remotely located, if these services do not reach them, it's not likely that we'll have the desired outcomes that we want to see. So these are huge challenges that we still have within the country, and that's why the design of the ANRIM project, to be able to tackle some of this and prevent the onset of malnutrition.
All right. Yes. Thank you very much, Dr. Zainab. It then seems that education becomes very crucial in all of this, and that's why I'm going to ask Dr. Nkwocha, how much of awareness is going into the project? How much of awareness is going into all that you're doing? Because if the people do not know, they need to know, for instance, what kind of foods will give them the best possible nutrition and all of those. How much are you prioritizing creating awareness?
Let me just give a little background on the National Council on Nutrition. So it was established. It was a resolution at the Federal Executive Council in February 2017. And it's domiciled in the office of the Vice President, and that's why the Vice President is the chairman of that particular council. If you look at page 45 through page 48 of the Renewed Hope manifesto of President Bola Ahmed Tinubu, it's where you have the health sector fully elaborated, and of course he spelled out his plans, duly spelled out. And so what the Vice President is doing is to orchestrate and build on that plan. How do we bring in, how has education now been impacted? The Vice President, if he has not held meeting on this Nutrition Council, has held meeting well over 8 times, and each time the meeting holds, there are stakeholders who come in, there are non-state actors who are in our collaborations, and of course being saddled with the responsibility of helping to disseminate the technicalities involved in ensuring that, look, the mandates, clarity, and of course purpose for President Bola Ahmed Tinubu's national policy on food and nutrition is well carried out. And so we're so proud, and that's why we're getting this stakeholder summit that's going to be holding. It's part of the education, it's part of the awareness, because clearly it's out there. No single man can hit a symphony. You need an orchestra to play it, all right? And so all hands must be on deck. So we need we are collaborating with stakeholders in the education sector, with civil service in the civil society sector, and that is what we're proving. And then, so that gradually we'll begin to see how can we bring in schools, make manifestos, make subjects, make sectors, make the private sector too look at it that, look, it's not just about the government, okay? Each and every one of us must see that, look, we have that passion, we have that commitment, we all have roles to play in ensuring that, look, that there is a positive correlation between nutrition and the productivity of this country. And so we're so happy that we're leveraging on some of these avenues that we could use to ensure that, look, at the long run, not just about the president nor the vice president, indeed the Nigerian nation is well off for it.
Okay, thank you so much, Mr. Stanley. Let us bring in Dr. Solanke into the conversation so that she can shed more light on what you have just talked about as the head, you know, of the IRIN project, because most of these children who need this nutrition are in the local communities. So what is the outreach like, in educating them? What are you using? What measures are you using? The traditional rulers, the people at the local government, the subnationals, the local government levels, and most of these children come from crisis-ridden places, where they can access this, and like places like Borno. So how are you reaching out to the traditional rulers to educate the populace on the need? Because every project that comes out of Nigeria, they must say, this is not good. We are not using it. So how are you educating them to let them know that they need to take it so that their children can grow better?
All right, thank you. So let me talk a little bit more about the project itself. The project has 2 components, driving it from the demand and the supply side. So what do we have? Are the facilities there available for, to provide the services to the people? Do we have the people willing to take up these services? And the sole aim of this project, the development objective, is to increase the utilization of the services. So how do we do that? So we provide the basic package of nutrition services. Like my colleague mentioned earlier, Dr. Zainab mentioned about maternal, infant and young child nutrition counseling for breastfeeding. A child is born, even before the birth of the child, the mother, we want to be sure that the mother takes the appropriate medication to prevent anemia, to prevent malaria, all those things that could jeopardize the health of the woman and the unborn child. But as soon as the child is born, we want to counsel the mother, put the baby to breast within the first hour of delivery, because we know the importance of colostrum. That first milk production, it helps to build immunity for that child. We want to counsel for exclusive breastfeeding. And at the end of the first 6 months, what about the complementary feeding? What happens? The child, other food components can be introduced to the child. Are they introduced in the right proportions, in the right quantity and quality? We want to ensure that it's still part of the counseling we give. And in addition to that, supplementation for micronutrient supplementation. We want to prevent parasitic infection that could strive with the nutrients for the child. Deworming, vitamin A. Those are the kind of services that we want to provide. And what do? We have the non-state actors who are working within the communities. They take these services to the children and their mothers at their communities. And at the same time, they are still provided under this project. We still have the primary health care facilities providing food demonstration to the pregnant women and how they can take care of their children complementary feeding. That's one aspect of it, talking about the demand. Now, what about the creating demand? We are using two-pronged approach to this, the mass media campaign. We have developed key messages that goes into various spots, TV and radio spots in Nigeria. They have been translated into local languages, talking about all our project sites. We have them in Nupe, in Niger, Kaduna State, all the key languages in Nigeria, they have been translated into. So you have our jingles running. And the other aspect of this is the interpersonal communication through the faith leaders. That's why we're bringing the traditional rulers, the faith leaders. They are the gatekeepers of the community. We have worked together with them, knowing the kind of work they have done in the past on the eradication of polio in Nigeria, through the issue of HIV in Nigeria, how they were instrumental to improving the quality of health of the people through educating them. And the messages that we have with them, we have given them orientation to mainstream it into their sermons. And again, they have opportunity to perform key life events with the people. An imam or a pastor in church joining a couple can tell them, madam, when you're pregnant, when the time comes, ensure that you attend your antenatal services. That's a way to address anemia in pregnancy, and they are part of it. When you have your child during naming ceremony, these are things that we have trained them, we've worked together with them, we have developed materials, we have developed books. One of the things that the Vice President will be launching at this summit is some of these materials that we have developed with them. They have opportunity to tell the mother, breastfeed your child exclusively. The messages are there for them. These are the things that you can give. For the traditional rulers, we know that some traditional beliefs that we have, like a child cannot eat egg or something like that, protein. But we know that these are the key things that the child should be, having.
That needs, yeah.
Exactly. There are some communities that even when a woman delivers newly, there are some food you cannot even take. They are taboos. But they have the opportunity to let them know that things are changing. We need to address malnutrition, chronic malnutrition, by imbibing some of the services and trainings that we're giving them. So it's a lot of education out there. And we know that the traditional leaders, the faith actors, they are part of the community. People listen to them. They have the influence, they have the followership, and they can work together with us to achieve this goal.
I know sometimes they will ask you this question, that what did your mother eat then? I mean, what did she give you then? You know, culture, tradition always affects policies by government, because they will say, aren't you strong? It's based on what your mother gave you and what she ate, so you have to abide by the culture and tradition. How do you change that mindset? How do you begin to do that?
Changing the norms. Yes, so the mass media campaigns are there. We have some of them running on NTA. Oh, a woman is pregnant. What should you do? Ensure you have your iron and folic acid tablet. The men are supposed to be vanguards for this. So we educate everyone. You know, they are supposed to support their wives to ensure they are taken care of during pregnancy. Okay, so during exclusive breastfeeding, oh, everybody knows we have jingles out there. Breastfeed your children when, you know, when they are newly born. Within the first hour of delivery and thereafter, do exclusive breastfeeding. Even for the complementary feeding, still continue breastfeeding. We can have everyone support the woman to breastfeed. The workplace and everyone is involved in this. Everybody. Nutrition is everybody's business. And we must see it as such. We must see it as such.
As such, yes.
The mass media campaign, I've mentioned it, on the airwaves, television spots, radio spots, they are there. The interpersonal communication through the faith leaders and traditional leaders, they are there. So now the vice president has taken it upon himself to have an engagement with them. And at the end of the day, there will be commitment from everyone. Within my domain, this is what I will do.
Okay.
There will be statements of commitments from them as well. I will continue to work with them, at least on the ARIN project for now.
All right, Dr. Sholanke, thank you very much. I'm just wondering, Dr. Zainab, technology plays such an important part in virtually everything that we do these days. It helps to reduce the amount of hands and legs that you may need, and maybe more effective in delivering certain messages. And so what efforts are you making to take advantage of technology to get the message to sync?
Yes, I think for one, I think it's important for us to say that as ANRIN project, we've been able to deploy technology in the services that are being delivered. As we've said earlier, we walk through two streams. One, through the non-state actors who have deployed a number of means of reaching out these messages through text messaging, where they also use some graphics to convey information to households that they serve with these services. And we've also been able to use the same technology to track the delivery of these services. For instance, under the ANRIN project, we have the web app, which helps us to take stock of all those beneficiaries that have been enrolled into the program. Each of the households that is being served, their details, including the mothers, the children that receive these services, including their phone numbers, so that at a click of a phone, you can actually reach any of those mothers, no matter how remotely located she is. And then we also use that to harvest the data that keeps track of the services being delivered to this teeming population of beneficiaries. So we use that to really see how far we have gone, and it gives us an instant, real-time information regarding who is being served, where they are located, and how much of these services they are obtaking, including the contacts. There's what we call contacts, where once you receive a particular service, if there's a need to do a revisit, the follow-up practices, it shows you at a glance using those technology. And of course, the data also helps us to know how many people are being reached with these services. Perhaps this will also help in tracking the investment that is being made. And again, I think there are two things that we have done under the ANRIN project, supported by the World Bank, where we have improved on the allocative efficiency of the investments that are being made. We did an optimization where we looked at current existing interventions, especially the nutrition specific interventions that helps us to reach these population groups that we target. And under that, we've been able to say, okay, this much, if you carry out maybe the maternal, infant, and young child nutrition intervention, the counseling that we do, this is how much it will fetch us in terms of getting people to create that knowledge and awareness for them to know where to obtain those services and to have the correct information that will help them prepare the right amount of food for their children, including the messaging around, effective breastfeeding, early initiation of breastfeeding within the first hour of birth, exclusive breastfeeding within the first 6 months of that child's life, and then complementary feeding and continue breastfeeding until the child is 2 years or beyond. So we'll be able to use technology to effectively deliver these messages and for mothers to now have the information that they need to make informed choices. And not just the mothers. Remember, we are talking about other secondary beneficiaries of the program, which include our faith leaders. Our faith leaders have been able to use some of this information correctly, and it has helped to improve uptake of services by our beneficiaries.
Okay, thank you. Apart from technology, now let's talk about Manpower. Who will be your partners? Is it the primary health care? Will they be brought in like they did during the polio? Because it's an expansive project. How are you going to actualize this? Do you have enough manpower to do that?
Everybody, including you.
Including me, yeah.
Yes, everybody. We need the media people. We need everyone to be part of us. We have a lot of partners working with us. As we've mentioned earlier, we receive technical and financial support from the World Bank and other partners working in the space with us. Global Finance Facility, GFF, Dangote Foundation, they work with us. They support us in terms of finances and even technical support. We need the government more for allocation of resources,
especially at the subnational.
At the subnational, and a lot of this optimization training that took place at the subnational level, where we can actually track our investment on nutrition. So, from the stage of planning, as we're planning the budget, we want to tag what are the ones that are for nutrition specific or nutrition sensitive, because almost all the other departments of government and ministries are involved. Ministry of Budget and National Planning for allocation of resources, Ministry of Water and Sanitation. I mentioned the issue of deworming for children. We have to have a very good environment for children to thrive, and have less of parasitic infections and everything. Ministry of Agric, because we have to be empowered, have enough food. Women Affairs, they are involved even on this project. We are having a multi-sectorial proof of concept in Gombe State as a pilot that we can scale up later, where we have all the relevant ministries coming together. So we are working in 3 local governments in Gombe State. And what do? Ministry of Agri goes in there, supplying, the households with maybe goats, chicken, for them to be able to be empowered, have something to eat within themselves first, and they can sell others to their neighbors or however they want to do it. The Ministry of Women Affairs come in, through the cooperatives, provide milling machines for the women, provide, the vulnerable households, milling machines, you can, from your products, whatever, as small-scale farmers that are there, you can mill your product and sell it and be empowered. An empowered woman will take care of the family better.
Community.
Exactly.
Yes,
so these are the kind of things for support from the Ministry of Health and Social Welfare in terms of the policies on health that should encourage everyone to carry along. And again, we're still talking about partnerships and collaboration. The faith leaders. That's why we're here today. And the Vice President will be leading a dialogue with them tomorrow. I'm sure they will be in town. Every one of them they are stakeholders. We work together to ensure that we deliver on this nutrition agenda of this current administration.
So you're targeting only women who are married with children?
No.
What are you also looking at younger girls who are coming up to have an idea, to have the information that when they get married, they don't need to, feel as if they don't know anything and they need to be guided? Is this going to be a guide for girls too, going into marriage and having children?
Absolutely. As part of our PDO, the Project Development Objective, we're targeting adolescent girls as well. And Ministry of Education, like I mentioned, we have other ministries working together with us on this. They go to the schools, especially in Gombe State, where we're having our pilot, give them the folic acid to build their reserve, the body reserve, onto the stage of pregnancy, and to prepare them for the future. And Dr. Zainab will be able to talk more about the adolescent target that we're doing, the pilot that we're doing in Kaduna State. They are working in Kaduna State for the adolescent girls alone. And by the time we, bring up lessons learned from the pilots we're doing in Gombe State, we can scale them up in future programming on nutrition.
All right. Thank you very much, Dr.
She said
Shulanke.
Dr. Zainab
I'll get to Dr. Zainab in a bit. But before then, I'm particularly, from all that we have gathered, the messaging appears to be key for women and children, particularly in vulnerable populations, talking about the rural areas and all of that. So apart from your general strategies at reaching out, what peculiar or particular communication strategy are you adopting to reach women and children in these rural areas?
So let me tell you some bit. At the last National Economic Council, Council mandated that there should be the establishment of a nutrition department in every ministry, department, and agency in the entire federal civil service and all our components. All right. So why did council do that? Council discovered that, look, except there's a deliberate entrenchment, except there's a deliberate movement, except there's a deliberate pushing of the agenda for food and nutrition, we might just be talking. And then if you take into cognizance again that for the very first time in the history of this country, we have a health budget with over 1.2 trillion naira. That has never happened. That shows commitment, that shows energy, that shows real political will to revamp the health sector. All right. So you could just aggregate it, okay, and say, okay, fine. How are we going to get to the root, to the root beneficiaries? And that is where the subnationals also come in. Like I said initially, it's not just about the president; it's a collective effort. The president is doing his will. The vice president is there. Head meetings, no less than 10 meetings that has brought us to this place. Okay, and so what will be the overall target? What will be the overall beneficiary now? And that is where we're having these stakeholder meetings, getting everybody on board to ensure that, look, whether it is in the school curriculum, for instance, there we are building it gradually, whether from tertiary, from primary to tertiary institutions, we are deliberately putting in policies. And in fairness to Mr. President, I don't think I've ever seen a president that, so whenever they talk about food, him and the vice president, you will see the passion, you would see the energy, you will see the will. They take it by force. The vice president has never been represented at any event that has to do with nutrient and food. All right, so it underscores a lot. It underscores the importance, not just him, but of course the overall commitment, vision, and of course noble objective of the government and President Bola Ahmed Tinubu.
So what is the role of policy and governance in addressing this? A lot of policies.
Okay, fine. So let me tell you, let me draw you back to what happened. If you remember, the polio, when polio vaccination ran into hitches. You understand? If you do understand, you understand what happened. Now, because some certain stakeholders, okay, that were vital to that particular policy execution, we are not taking into cognizance in the execution. You could have a very robust, very beautiful policy, all right? You could bring the best of experts to come execute. But if the wrong implementation strategy is adopted, that's where you have flaws. Now, in the case of polio, if you remember, it ran into hitches because some cultural diversities that were in place, our cultural, ethnic, and religious diversity, we are not taking into consideration in the execution of that particular policy. And so there was a drawback, there was a pushback. A lot of people resented it. But when that particular mistake was observed and the traditional rulers were brought in, faith leaders were brought in, you saw the magic it did to the polio, and then within a twinkle of an eye, polio was eradicated from Nigeria, okay? So the same thing too, the vice president, having noticed that, having taken key consideration of some of the lapses and challenges that had existed in the past, has now made this robust planning. How do we make sure that, look, everybody is on board, no one is left alone, whether it's from the subnationals, whether it's from the non-state actors, the civil society organizations, the media, of course. I'm a product of the media, and I've taken, of course, and I'm so proud of the things we've done in the past 3-4 days, making sure. And then as we leave here, by noon, we're going to be having a press conference again to further narrow in the essence. You can't have a president that has committed for the very first time in the history of this country 1.2 trillion naira in the health sector, brought in a global expert in the person of Professor Ali Patti to come man the health sector, and then we cannot all rally around behind him and ensure that this particular objective and his visions are met. And so that is why we are here. And of course, we appreciate what NTA is doing with your kind support and very, very lovely technical and media support. We'll definitely hit the hit in the head.
What do you think will be at the heart of the Vice President's message as the summit opens tomorrow?
He will be appealing to the conscience, the involvement, the collaboration, the cooperation, and of course the wherewithal of the faith leaders and all stakeholders, taking into cognizance that, look, I and you are here. I do not know how many followers you might have on your social media, but if you go to some of our faith leaders, you'll be so shocked at the number of followers they have.
Millions.
Not just in the social media outlets. Take for instance, I mean, we have apart from football stadia around the world, some of the biggest places that have the highest number of worshippers are the churches, of course, and of course the mosque. So you have 100 capacity churches, you have 200 capacity mosque and everything. So imagine if you use such media to reach out to the Nigerian people, okay, and they cue into your vision, cue into the president's acceptability, his own foresight in ensuring that, look, this is a program that is meant for Nigerian people. This is a particular policy that the president is committed to with the right funding. I mean, it's just a matter of not years, months from now, and we're going to see a much more enhanced productivity at a national level.
Dr. Zainab.
Yes, for me, I think I'll touch on two key things that have been mentioned here. One, the messaging. I think you did ask about how do the messages reach our teeming population of beneficiaries. Beyond what he has said in terms of policy and the arrangements, the coordination efforts, the multi-sectoral approach that is being deployed, we have really used our SBCC strategy, the campaigns, to set out or to present messages on very myriad of media outlets, on radio, on TV, the social media handles, where 5 key messages have been dished out. One, to do with practice of breastfeeding, promoting breastfeeding. And in those messages, we talk about early initiation of breastfeeding, the importance and the benefits that they stand to gain within the first hour of life. And then the exclusive breastfeeding for the first 6 months of that child's life, where we encourage mothers to exclusively breastfeed without any combination or addition to that breast milk. And then once the child is 6 months old, we know that breast milk is no longer adequate for that child. While we encourage them to continue breastfeeding, the message also emphasizes the need to introduce appropriate and adequate complementary feeds. And then once that happens, we also have this message on the iron folic acid uptake, especially by our young girls. You did ask about the adolescents.
Yeah.
Yes, they are very key. And this is one of the things that we're doing in Kaduna State, where we have a special focus on our adolescent girls, particularly the married adolescent girls. They also have children. So the messages that go to them is how they should breastfeed their kids, the kind of foods they should prepare, the other maternal, infant, and young child nutrition practices, and then their ability to really understand the dynamics and be able to prepare the meals. And then we also have messages around, hand washing. Our national program manager had talked about the issue of how the environment, can contribute to ill health. And we know the vicious circle that sets in when a child is sick, the child is not able to feed, and that also can push that child to malnutrition. So messages around that. And then we also have a message that has to do with vitamin A supplementation. The micronutrient dense foods that children need to take. So we have messages around that. So our SBCC strategy, the campaigns that we do, is very key in passing on those messages. And then we also have the out of home, what we call the out of home campaign, where we have messages on keke, these tricycles and so on, and even on the walls of hospitals and homes. We have done those, and these have really been very impactful in creating awareness and the people's knowledge has also been increased, and they now know where to go for to access these services. So I would want to say that messaging along that direction has helped us to reach our population, target beneficiaries, as well as other caregivers that help to influence the decisions that our mothers and their caregivers take. I think one other issue that I think it's important for us to also emphasize here is the issue of the multi-sectoral coordination. We have had different sectors play their role. We know that the health sector alone cannot deliver on most of these targets that we intend to achieve, or the objectives that we intend to achieve for nutrition. If you don't have the right roads, you don't have the right information, like happens through our ministries of education, where nutrition education is very key, then it's not likely that we'll win the fight against malnutrition. So, and then we also have sectors like the transport. You know, some people are remotely located, and if you don't have good roads, it's not likely that they can access the services. And we're talking about improving our primary healthcare services. We want our primary healthcare centers to really have what it takes to provide the services that they require. And if those things are put in proper shape, it's likely that people will now access the right services, and they'll be able to have them utilize the health facilities that have been set up. So that way, we need the vehicle, and one of the vehicles that is required to bridge that gap is our religious leaders. They serve as a referral conduit. They serve as a key component that helps to push for these services to be available to our people.
Okay. Thank you very much, Dr. Zainab. I was just wondering, you talked a lot about micronutrient dense foods. For emphasis, what are the most available and affordable foods that constitute that, or that have these that are micronutrient dense and that our people can easily get? How available, how affordable are they?
Yes, if you look at the the dynamics of the country as a whole, there's no part of this country that do not have locally available foodstuff that are nutrient rich. If you look at the north, you look at the south, you look at the east or west of this country, we have foods that are seasonal. And most of these foods, you can name it. Whether you're talking about, we have about 10 food groups that we look at. We look at the proteins, we look at, we no longer say protein, carbohydrate, and fats, and so on. We look at food items or food groups that constitute the dairy or the milk group. We have the fish, we don't just say, we don't lump them up and say they're protein. And then we have the leafy vegetables, we have the fruits, we have the rice, the cereal food group. We also have the legumes. So all of these are very critical. And we say that if at least people have 5, especially children, what we call the 5-star diet, if we have them combine these different food groups to the advantage of that child, then we can say that the child has an adequate diet that is diverse in the right amounts, in the right quality, for them to be able to get what is needed for optimal growth, development, and survival. So when we talk about nutrient-dense food, we're looking at what is available in any which environment that they can actually get most of this nutrients from, for them to say they are adequately nourished and they have the right nutrients to grow and develop. So you can't just pick one and say this is what we mean by nutrient-dense food. We have them in abundance, but a lot of the times people don't have the knowledge of how to combine this food, or even how to ensure that the little that is available to them, they're able to use them judiciously in a way that can nourish that child and can also make sure that the child is getting enough to survive and to thrive.
Okay, well, let me bring in Dr. Solanke here. You've said a lot and you've raised some pertinent questions, but let us look at the realities of life now. How hard things are for people, especially in the local rural areas, to even feed, and how are you going to work in conjunction with the NGOs that have been on the outreach to these people for a very long time, especially in the Northeast?
Okay, so we're talking about affordability of food, and honestly, the basic needs of food, they shouldn't be expensive. We encourage the women, households to have homestead gardens. That is what the Ministry of Agric is doing. And, you know, for the efforts on the project, we're providing even stock, maybe animal stock, you know, to the women, you know, so that just have it in your backyard. You can eat from it, you can sell from it, and sustain your family for other things, send your children to school. So the basic nutrient that we need for this food, you can have your vegetables, you know, that we all know has a lot of vitamins and minerals. You can have your chicken, you know, in your backyard. You have your eggs from there and all those things. So these are the kind of things that we're encouraging. The homegrown sources that we can have within us. They don't have to be imported food.
They have so much space in the rural areas.
Exactly. And again, one thing that we're trying to do on this project is to draw attention, you know, to the issue of nutrition, you know, to make nutrition as part of the agenda. It's already on the agenda of this administration, and nutrition is taking a lot of attention at the moment, you know, mobilizing resources to ensure that the programming for nutrition along the line ministries are there. And one of the key things that we did in terms of sustainability of the project, especially at the subnational level, is to ensure that to be part of this project, the government will have a commitment fund to create a budget line for nutrition and its services in their state. So hopefully after the end of this project, they can continue in that line and even increase resources towards that. We have a lot of partners coming in to partner with us at the moment. A lot of NGOs, you know, quite a number of them are supporting. We are working together at the community level to ensure that we reach the objective of nutrition generally, not only for ARIN project. ARIN is just a measure, you know, of what the federal government is doing to promote nutrition in Nigeria and address malnutrition, chronic malnutrition, especially through the work of the bank. I mentioned earlier that we have support from the bank in terms of finances and also technical assistance from them.
What will be the lifespan of the project?
The project is winding down, but graciously we got an extension for another year. But beyond the project, what else? What can we do for ourselves? That's what we're looking at. Sustainability. Our faith leaders, let them own what we have been able to work together with. That's why this kind of dialogue is happening. And they can take it on. We can have other diseases added to that. They are part of the community vanguards that will help us to promote health. It's a continuous one.
And how well are you pushing for policies, especially since the ARIN project is just 1 more year to go? How well are you pushing for policies that will keep, you know, the push for nutrition going?
The coordinating minister of health and social welfare is committed to the issue of nutrition. At the moment, we are trying to train all the health workers, primary healthcare workers in all the states and the local governments, wherever they exist, primary healthcare centers, the workers working there, they will be trained. We're going to be rolling out training in all the facilities that we have, that everyone providing services will be able to do the right thing, provide the right counseling, the messaging to the people who come to take services from those facilities. And we have, you know, the primary healthcare development agencies, they work with us on this project as well, together with the state primary healthcare boards and agencies that we have. And we're all working together on this to ensure that when the women, you know, access the facilities, they have people who would attend to them with respect and provide the right services to them. We have the equipment that they will use to attend to this, and we have funding through the Basic Healthcare Provision Fund that is available at the Ministry of Health that we have now. So everything is working, you know, little pieces of the puzzle working together to ensure that we have better, healthy nation, you know, and a lot of our people, especially at the rural subnational level, they benefit maximally from the health agenda of this administration.
In other words, we'll be sure of sustainability,
sure,
scalability.
Yes. Yes. Yes.
And we have community health workers at the community level that have also received this capacity building. So a lot of capacity has been built within the system, which will assure sustainability in the long run.
And trust me, I do not think we've had any past president or administration that is so committed to revamping the health sector like the president does. You see it in him. He preaches it. It's in him. He's so passionate about it. Improved funding everywhere, especially in the health sector. So I think with initiatives like this, with collaborations like this, all we need is the support of Nigerian people. All we need is for all hands to be on deck. Like I said earlier on, no one single person can whistle a symphony. It takes an orchestra to play it. Collective effort. So we must all come together and ensure that, look, the visions, aspirations, and policies of these administrations are definitely executed to the letter.
So what can we learn and build on right now?
Well, what we've learned is that, look, if you're in policy formation, for instance, you start with formation process. Of course, you move on to your implementation, and then subsequently you move on to the evaluation process. Okay. Now, if you look at where have we made mistakes in the past, where have there been shortcomings, where have we not maximized our potentials as a nation, taking into cognizance that, look, that we are one of our population is one of the most in the whole entire world. So are we just large numbers just for the fun of it? No. Whether in terms of resources, whether in terms of endowments, whether in terms of the God-given assets God have given us, there must be definitely things we can learn. And one of the things I believe we can learn from an initiative like this, that when we all come together, support our leaders, trust them, that look, with the right commitments, that definitely will go places. I mean, I gave the example of polio. It's a simple, direct replica of what you could achieve when you factor each and every person to come on board and definitely help in the execution of a tax. Right? Luckily for us, we have leaders who are definitely committed to that. You could see the passion with which the two medical doctors here spoke. You could see the commitments. I've not rested. For the past how many days? They've been on me. You know, each and every time. You know, we were in Lagos.
They are women, so
yeah,
they feel
exactly.
the pinch there.
So we're in Lagos,
yes.
we're in Lagos on Saturday.
Yes.
We're in Lagos on Saturday. On Sunday, we came back to Abuja, and then no rest, and then here we are. So it's the passion we need, it's the drive we need. Trust me, by the special grace of God, we'll definitely get there. And given the commitment of President Bola Ahmed Tinubu, I tell you, in no long time from now, Nigerians will be the better off for it.
Who is attending the summit tomorrow?
The vice president. The vice president will be. He is the chairman of nutrition, the National
Yes,
Council
we'll
of
get
Nutrition.
to talk about that.
Yeah,
we'll get to talk about that expansively when we return for this break.
Thank you.
Do stay with us. You're welcome back, and our guests are still seated in the studio. Earlier, we were talking about bridging the nutrition gap in Nigeria. Now, there'll be a summit tomorrow, and we would like to get more information on it so that Nigerians can follow up, you know, on all the platforms on how the summit goes. Now, Mr. Stanley, I'm coming to you now. You are on the hot seat now. Yes. We know, those who know the vice president knows how his mind works, actually, and things that people don't take serious will grab his attention and he work on it, and it will always be a success. So tell us about this summit of faith leaders of nutrition in Nigeria coming together, and what really got the attention of the Vice President Kashim Shettima to go all out for the summit.
Thank you. I'm glad you have such kind words for the Vice President, you know. And for me, having the opportunity to work with him is it's been very, very awesome. It's been a learning curve, a learning process for me. Because, I mean, the more you work with him, the more you get to realize why it is that the president did pick him to assist in piloting the affairs of this nation. And so, coming to your question, it's not just about his statutory role as the chairman of National Council of Nutrition. For him, he sees it beyond that. For him, it's a passion. For him, I've seen him a couple of times stopping his convoy and attending to people. It's in him naturally. And then, of course, too, you take the narrative from when he was a governor.
Yes.
This was a man who ensured that, look, that he deliberately, he was not interested in the funds coming on, right? Despite the security challenges that were there, he was building houses, building health centers, building schools. I'm proud to say that Borno State has some of the best schools you can ever
See in the
see
country,
anywhere.
yes.
You need to go to those schools. You see where he started feeding children, provided school for orphans. bought school buses from America, plying the children. And it would interest you to know that when he put in his policies in Borno State, the enrollment rate in Borno State skyrocketed, jumped. It was a massive revolution that occurred. And so in defiance security, despite the threat of security, this was a man that said, no, that I will not let this state go down. And he didn't. And so he has moved on he has passed the baton to Professor Zulum, who is also doing well. So for the Vice President, it's not because he is the chairman, no, of the National Council on Nutrition. No, it's beyond that. It's a passion. It's an oath he's taken, and as far as he's concerned, the objectives and policies of Mr. President would definitely be executed without hindrance. And so for what caught his passion, you need to see during his meetings are usually very, very interesting, especially for the women folk, by the way. Whenever there are meetings going on, the first thing he does, I'm sorry to say this, he uses his left. He goes 1, 2, 3, 4. And if the number of women are not enough, he asks, please, why are the number of women less? Why are the men here? And it's natural for him. Recently, we had about 60 medical doctors, all female medical doctors. He trained, he sponsored.
As a governor, yes.
Yes, a governor who went to Sudan, came back as medical doctor, all female. And he ensured that, look, each and every local government in Borno State was adequately represented. So there was nothing like marginalization. There was no the religious divide in them. And so for him, it's beyond just policy. It's a passion in him.
Yes.
It's a belief in him. And that's why when this nutrition dialogue came up, he said, look, let's give all the support and ensure that, look, the visions of Mr. President are definitely carried to the letter. Mr. President cannot be spending such amount of money, cannot be taking his time articulating beautiful policies like this, ensuring. I said something that the last National Economic Council, that nutrition departments were enforced. It has become law. It's a rule now that for each and every ministry, you must have the Department of Nutrition. And this was a resolution reached not more than 2 months ago at the last National Economic Council. So Mr. President is not playing to the gallery. The Vice President is not playing to the gallery. There is a committed, sustained effort at definitely pulling our health sector out of the wood. And you could see it in all ramifications.
So what does this summit aim to achieve?
It's a simple message that with all Nigerians' hands on the deck, nothing is insurmountable. Not just in the health sector. In each and every sector of our economy, that if we believe and come together as a nation with the support of our leaders, that nothing, and that, look, no man is an island. I've never seen the president shy away from his inadequacies, not even the vice president. At each and every time where they have their own shortcomings, they do not ever boast to know it all. And in a summit like this, in an environment like this, in a dialogue like this, in a meeting like this, they're also manifesting it, that, look, we need the support of all Nigerians, faith leaders, traditional rulers, non-state actors, the subnationals. What this summit is saying, everyone come on board. Let's put our hands together and see how we can, with our commitment, strength, and with our population, collectively move the nation forward. That's the message.
What's the theme for this summit, and how crucial is it to achieving what we've just read?
Doctor can take that, eh?
Okay.
Dr. Zainab.
Dr. Zainab.
Yes, I think one of the key things we seek to achieve, or the objective of this summit, is to, like he had said, utilize the faith leaders, the faith actors, to leverage on the respect that they have, the dignity that they command, and also the spiritual, knowledge that they have to influence those decisions. Remember, we talked about the best practices that has to do with maternal, infant, and young child nutrition. The correct information will then be appropriately passed, and they'll be committed to that drive. Even beyond the ANRIM project, we expect to see them play that role more effectively. They are going to sign off on that through the Office of the Vice President under his watch to make that commitment. So the summit is actually to promote that initiative to say they are a catalyst to ensuring that we have improved human capital through nutrition intervention. And the sermons that they will be providing, we have within it the scriptural provisions that will enhance people's acceptability of those messages. So in essence, use of that platform will help drive home the message, will also help commit people and also help to mobilize so that they uptake services that will enhance their life and their overall well-being. So we believe that as a vehicle, as key custodians of both culture and religion, they are in the best position to actually speak to these issues and encourage people to imbibe the right kind of knowledge and also practice that will see us get out of this problem. Because for us, we feel that prevention is better than cure. We don't want to see malnourished children. We don't want to see children going into chronic malnutrition, which is something that is irreversible. So they have a very key role to play.
Faith leaders that will be attending
and
tomorrow.
Traditional rulers as well. Our traditional rulers are also in the forefront of this drive.
So what do you, in your own perception, in your way of thinking, what do you think will be the outcome from the summit?
Okay, so we'll be getting a statement of action from them.
Okay.
And we're working with 2 NGOs, the Kuka Center and the Sultan Foundation. They've been on board with us. We've been working with CAN and GNI. So we'll take it up from there. After this commitment, you know, and going forward, we'll be monitoring their actions. So how many sermons have been delivered, you know, by each of the sector based on their commitments. And sometimes we go there with them too, to see this, and we can monitor things from there. So at least one of the key outcomes is to have a statement of action, which we can track and monitor over time.
Do you hope that IRIN will be extended beyond 1 year?
So,
because, you know, the work never finishes.
So
more people
even
are
beyond
born, more
IRIN,
people are growing up, you know, and all that.
IRIN or no IRIN, I am confident the Honorable Minister of Health and Social Welfare is committed to the issue of nutrition, and he will continue to drive it. It's one of his priorities. And a lot of attention, you know, with the we mentioned earlier that with the National Council on Nutrition, all the line ministries that has something to do with nutrition, you know, have a department to draw attention to the operations of nutrition. So I am so sure that the Minister of Health and Social Welfare is committed to that, and from going on from now, even after IRIN, nutrition agenda continues.
It's a continuous.
Yes.
IRIN is the proof of concept.
Yeah.
Come out to demonstrate that things can be done differently and for better results.
But why do you think that malnutrition has remained a pervasive issue in Nigeria? And this is in spite of, you know, concerted efforts and policy frameworks in the past.
I think because there's more awareness, there's more knowledge, people are now more conscious of this issue. It's now has gained traction, especially from the pronouncements of the Vice President of the Federal Republic of Nigeria. He has a passion for that. He has been able to put it in the front burner, and it is gaining attention of all our governments across the different levels.
Okay, Mr. Stanley, I remember the President saying that no Nigerian will go to bed hungry. And we have a President and a Vice President who are like minds. They think alike, and then whatever policy they bring out, it is a well thought out policy. So there's a prevailing food crisis in the country, and it has its attendant, you know, risks on health, malnutrition, and well-being, because they say a well-fed nation is a more productive nation, and they can do one. So after this summit, what next?
Well, just before you also agree with me that the food crisis is beginning to abate. We have, of course, food banks being opened up, you know, and of course, you have it's not just about Mr. President. You know, you could see the involvement of subnationals. If you check the federal allocation that's been shared over the months since the president assumed office, unprecedented in the history of Nigerians. In the history of Nigeria, You know, so those are deliberate, you know, and then of course too, you also have interventions, food interventions directly, you know, and of course to the call for ingenious ideas to become. So these are all aspects that the president, of course, has taken up upon himself. So we're not, the government is not unmindful of the challenges that we're facing as a nation. But of course, too, after the summit, or what we're looking at, okay, what would be the deliverables now? Yes. After the summit, we are looking at instances where, okay, fine, these are the clear path routes for implementation, where we could have far-reaching impacts, far-reaching effects. These are the results. These are the strategies that we could use. These are the adoptions. It's not just going to be a talk shop tomorrow. It won't be, by the special grace of God. It will be an action-packed moment where we should be able to tell ourselves the truth as a nation. Where have we had our shortcomings? Where do we need more to be done? Where it is that we need more to be amplified? You know, what are there instances where culture, tradition, religion, tribalism has set us back? If they've done so, what are the steps that we should take in conquering these particular fears? And are there reasons why we should trust this government more? These are all. These are things that we shall be bringing, so that, like I said, very soon at the. You've done your formulation, you've done your implementation. Very soon there will be the phase for the evaluation of these policies. And at the evaluation of these policies, which your question is tending to, I pray that by that time we already have a clear-cut program of action that definitely when we implement, when we look at them, we should be proud and say, yes, collectively, from the president to the common man on the street, in quote, that look, we all collectively achieved this. And that is what we are looking at, the overall benefit, benefit to the Nigerian there on the street.
Your last comments have attracted my attention, because you will often hear people say the problem with Nigeria is not policies. We've always had policies, but we don't implement.
Exactly.
Same way we have always had talk shops, we have had summits like this, and nothing much seemed to come out of them. So what assurances are you given that this is going to be something different from the rest?
You know, when the assurance I'm going to give you is that with President Bola Ahmed Tinubu,
so that if I see you on the streets, I hold you and say you said
no,
so.
And you don't report me to the president. The assurance I'm giving you is that, given the focus of this administration, given the mindset and directive of Mr. President, which the Vice President is executing, it is going to be a success at the end of the day. And I'll give you my reason. The man who is driving this initiative, that is the Vice President, is a man who is known of when he was a governor. All right? If you remember, and I'm just going to chip in this, so you know how focused, how serious he is. The Third Fund project, where you have the 2.5 billion naira counterpart funding, of all the governors during his set, he was the only one amongst the governors meeting up his 2.5 billion naira requirement. And so he was assessing the 5 billion naira Third Fund project for his state twice. Yes. 2.5 billion naira. He was, so you could begin to ask, what mathematics, what engineering, what acumen did he bring in while other governors were crying and saying they cannot afford 2.5, but here you are, a governor who was saddled with the security crisis in Borno State, was always meeting up with his 2.5, and it is now reflecting in Borno State, where you have the best of schools, where you have more enrollment in child education, where you have state-of-the-art facilities. And I tell you something.
And he started the school feeding.
Exactly. That's why I said initially that he started the school feeding, and that school feeding initiative and strategy trumped school enrollment like we've never seen, unprecedented before. And then guess what? There is an initiative called the Pulaku Project. Maybe Sunday we'll come and then talk about it.
All right.
That Pulaku Project, in it, guess what he said in one of the meetings? I hope he doesn't give me a hit on the back when I go back. He said, look, that he's going to, the kind of schools that will be built under the Pulaku initiative will be unprecedented. And that is his commitment. So you see a man that, look, is not playing to the gallery. Already the Pulaku project is on the pipeline, but he's already thinking ahead of the kind of buildings, the kind of schools that should go into those projects. We can only say thank you for Mr. President, for his vision, and of course the Vice President for marshalling out these plans.
All right. Now, let me ask Dr. Sholanke, you're a national manager, national project manager. What blueprint is there, if there's any already, for implementation? Because that's crucial. After all the talk and after all that you are doing now, if you don't implement, then it boils down to nothing. Is there a blueprint?
So we have, we'll be expecting a statement of action from the religious leaders from the summit, and that we can track and monitor its implementation. We'll be working with the, like I mentioned, we'll be working with 2 NGOs, the Sultan Foundation for the Islamic Faith and the Father Kuka Center. You know, they'll be working with us so that we can navigate through the 2 bodies together. We've been working with CAN and GNI. We have the structure already on ground, and we'll continue to implement with them further programming, bringing all the people who would not be able to attend this program tomorrow, so that we can continue to reinforce this commitment by which their leadership have made on their behalf, and we see the implementation and we monitor them and see how we can assist them further. Because we really want to entrust this into their hands beyond ARIN. We want them to take ownership. We want them to continue to work in that line. That's why we're working with the NGOs, the Sultan Foundation and the Kuka Center, so that they can help us beyond ARIN. We can still look back at, oh, where are we on this work that we started together a few years back.
So who will be signing the dotted lines at the summit? You know, to, you know, a statement of commitment, you know, to the promotion of nutrition party. Who will be signing the dotted? Who are those that will be signing it?
We are expecting the Sultan
all the
himself,
stakeholders?
all the key leaders.
Okay.
The Sultan of Sokoto himself will be at the meeting tomorrow. We are expecting the CAN president and all the key religious bodies, the traditional rulers who are there. They will be part of this and they will all sign tomorrow.
Dr. Zainab, any side attractions, anything apart from the serious talk?
For me, I think in addition to what Dr. Sholanke had mentioned, there are documented materials. We have materials that have been developed with those key messages that have captured the scriptures that they can use, and this makes for the sustainability that we're talking about. And they will be committed to that, and they will use these materials to pass on the right messages.
Mr. Stanley, where's the time? What's the time, and where's the venue of this summit?
The venue is at the State House Banquet Hall.
So it's not open to everyone.
No, it is. It is. You
If
could
I want
come
to
in.
attend, for instance.
Yes, if I want to come.
And I want you, the 2 of you, to come, so that Victor, aside from his family and his church and then the NTA workstation, I'm sure that very soon that the chief in his village is going to give me a traditional title. So you can also ensure that, look, he has nutrition as one of those things you present to them. Thank you, Jumai, for all the support.
We know.
You know, Nigeria is a country blessed with a lot of food, and so you begin to wonder why we should be talking about, malnutrition and all of that. Some have attributed this to insecurity in some parts of the country, which we haven't shied away from. How much of a problem is this?
Let me say that for a state that I come from, which is Kaduna, we have had our own fair share of insecurity, but that does not deter us from providing these services in even those security compromised areas. For instance, there are local governments that are very well known for insecurity. We've been able to deploy and even reach those communities with services. Of course, strategies were used to use people within those communities to make sure that they are not left behind in terms of getting these services across to their children and other vulnerable population groups that we serve. So I think one of the things we need to also understand is that insecurity is not something you plan for. You don't anticipate it. And sometimes it happens in even places where they are hitherto known to be peaceful.
Yeah.
So for us, we just have to be on alert, and that's why every intervention that we do, especially under the ANRIM project, we're very proactive. It's part of the design of the project to say, come rain or shine, these services must reach the children, the pregnant women, lactating mothers, adolescents, and everyone that needs to receive these services.
And just to add to that, you mentioned we have food everywhere, and why are we talking about malnutrition? In some of our experiences, we realize in some agrarian communities, we know that there are farmers there. But why are the children still malnourished? We were wondering what happens. So getting further into the community, we realized that the farmers there, they sell off all their produce.
Yes.
And they don't even have any for the children back at home. So we wonder why. So nutrition education is very important. Like I mentioned, some of the taboos that we were talking about, people don't even believe that you give a child an egg. You understand such funny things? Yeah, they are available, but are we applying them rightly? Are we combining the food groups together in the right quantity that they should be? Yes, we are not, we have food. The breast milk that God has given women as the first food, and we know it has been proven, 6 months exclusively. A child, have you seen an exclusive breastfed child before? Do you know the difference?
Yeah,
so why are we not imbibing those little actions, concepts that are proven to be correct and working?
Some will attribute it to now women are most of the time out of the house. They work in the offices. It's not like during our parents' time when they were natural, staying at home to take care of the family. Women have to go out. Maybe that's why. Do you think the exclusive breastfeeding is not really working in Nigeria?
It is really working, and we have initiatives, the breastfeeding initiatives in all of our states. We are supporting that too, to ensure that most organizations, nothing stops NTA from having a little creche. Yeah, somewhere here. If I have a child and I happen to be working in NTA here, I can go back to, my child can come with me, go to the creche and have my child breastfed. Those are the kind of initiative
which
that we are
most
promoting.
Organizations don't have a crèche in the office to take care of mothers and their children.
But funny enough, a lot of organizations
what are you going to do as part of your advocacy to ensure that offices do have a crèche for mothers? Yes.
I think I should come in here.
Yeah.
For instance, we have worked in some of our states, our project states, to promote the issue of 6 months maternity leave. We've done that, I think, in Kaduna and Oyo.
6 months.
We've accomplished that. Yes, 6 months maternity leave has been granted to our working class mothers.
In the
and
states.
they're really, in the state.
Even at the national level.
So, yes, number of states. But for us as unwritten states, I know we have accomplished that. And
why not 1 year?
Well, that would be asking for too much. No. We are talking about exclusive breastfeeding. So for us,
why not 1 year?
For us to
it's the formative, life of the baby, and the mother is there.
Well, maybe that would be the next phase of advocacy. That
I think you, as a woman, I feel it should be 1 year.
I was trying to ask Dr. Shola earlier when she was talking about the NTA baby, whether I looked like one. But I would like to thank all of you for coming on the program today. Dr. Zainab Kwaru Muhammad Idris, Project Coordinator, ANRIN Project in Kaduna State, and National President-elect Medical Women's Association of Nigeria. Congratulations.
Congratulations.
And thank you for coming on the program.
It's my pleasure.
All right, let's also thank Dr. Juolakbe Oluto Sinsholanke, National Project Manager, ANRIN Project. It's been a pleasure having you here. And our own Stanley Nkwocha, Senior Special Assistant of Media and Communications, Office of the Vice President. Thank you for joining us.
Yes,
Victor and Jumai, it's wonderful time we spent here. Thank you so much for your commitment.
Time just flew.
Thank you.
That's been Good Morning Nigeria today. Tomorrow is another day. Let's keep the date, and we'll see you then. I'm Victor Azuba for now.
And I am Jumai Yusuf. Programming continues on the network service of the NTA. Do enjoy the rest of the day.